Hi, I'm Gaynor. I am a mum and a new nana. I like to make nice cakes for my girls. I work at the hospital, so I spend a lot of time talking with people and doing lots of admin tasks. Making a 21st and a first birthday cake, quite technically difficult with fondant.
Yep.
On one weekend, because the eldest daughter decided to have a baby a day after her sister's 20th birthday.
Mm-hmm.
Then got through both parties and then had no feeling in my hand.
Okay, so it was numb.
Totally numb. Pretty blessed to have a daughter who is an OT but on maternity leave, and my youngest daughter is an OT student, so they recommended you guys.
Yep.
And was lucky enough to bring my youngest daughter to explain what was going on, because it's quite difficult. All it felt like was painful but numb all at the same time.
Yeah. Did you have strength, or do you lose strength or movement?
Totally.
Yeah.
Totally. Turning on a tap, no go. But I know nothing about hands,
Yeah.
how complicated they are. I knew nothing about how to explain symptoms.
Yeah.
Crazy, just crazy. There was people out there that I could ask, but just didn't really know what steps to take to do it. So I was pretty lucky that I had the girls to help me. I met Georgia and she showed me some things, did some tests which all seemed very weird, and then made a brace, rested, which is really difficult when you're really busy, when you're working and you're a mum and a grandma and a wife, housewife, the whole lot.
You're quite an active person, aren't you? You like to use your hands a lot.
Yeah, forced rest, getting used to that.
Yeah.
Making sure that you're doing what you're asked to do.
Yeah.
And follow-up visits, just seeing some improvements. It does take time, which is very frustrating when you're impatient. A forced rest.
Yeah.
So it had to rest, it had to improve, whereas if you're trying to do things for yourself and you're not a clinical person, you just go, I'll just wrap it up. That the splint is definitely the way to go.
Yeah.
For that type of injury.
Yeah.
And getting professional help. That you're going to fix it that day. It didn't happen.
And how did you feel when it didn't happen?
Sad.
Okay.
Very, very sad. I was lucky enough to have people explain to me how it was all going to work and what processes.
Did that help?
Yes, definitely. And having Georgia explain that throughout the process too just made me feel a lot better that it was going to get better. Probably having to rest it.
Mm-hmm.
Yeah, because you just think that it's, you can just magically make it better. Everything. From when it was really sore to having to rest it to wearing the brace, everything. Coming here, not hard at all. The respect. And not being treated like I didn't know what I was talking about, asking more questions, feeling comfortable to say, I know it sounds silly, but this is what it's doing. I'd recommend it. I hope I don't have to do it again, but if I did, I'd do it sooner rather than later. Go early, be patient. Listen, follow all the exercises because that does help get better. It's hard to do the exercises. Get lots of instructions. If you're not good at following things on your own when you get home, because they will give it to you. They'll make it easy for you.